Recording now. So thank you all for joining this webinar. We are excited to be moving into the next phase of this project and sharing with you all everything that we've got put together to help Oregonians as they move through the Medicaid redeterminations process. So we're going to talk a little bit about what that's going to look like here. My name is Amy Coven. I'm the Stakeholder and Communications Analyst with the Oregon Health Insurance Marketplace. We are a division, or an office, I should say, within the Oregon Health Authority Health Policy and Analytics Division. And we are, as part of the redeterminations project with the Medicaid redeterminations, I should say, we are standing up a project called the Marketplace Transition Project. So that is what this webinar is aimed to help you with. So just to kind of level set and make sure everyone is on the same page, you hopefully have seen a variation of this timeline. It's been floating around for a little while now, but this is the timeline of the redeterminations work for the Medicaid redeterminations project. So the redeterminations will begin in April. What that means is that everyone who is currently an OHP member or is receiving benefits from the state, so that includes SNAP and all of those benefits, will need to go through a redetermination process to determine if they are still eligible for those benefits. The reason for this is that because since the COVID-19 pandemic began, Medicaid has been under what's called a continuous coverage requirement. And so that means that even if you had an increase in income or some other sort of life change that would typically, basically remove you from OHP, that has not been the case since the continuous coverage requirement began. So there are going to be about 1.47 million OHP enrollees that have to go through this process. And it's estimated that somewhere around 300,000 of them may no longer qualify for OHP benefits. And so what that looks like is that they may, there's going to be a few different options. There is an expanded Medicaid program that is kind of in the works. And so that may be an option for folks that are within 200% of the federal poverty level. But for a lot of people, that means that they're going to have to explore new coverage options, including through the marketplace, which is why we're here today. So just again, as an overview for the project, the state is anticipating that up to 300,000 Oregonians that are currently enrolled in the Oregon Health Plan will no longer be eligible. This means that there's going to be a lot of people that are going to be looking for other coverage options. And we know that a lot of these folks may have not had to do this process in the past. So there's going to be some health literacy gaps, and some knowledge gaps about other coverage options. And so that's where our project really comes in. So the Marketplace and the Oregon Health Plan teams are collaborating very closely to implement a migration process. Because we are using the federal platform, we cannot auto-enroll people into Marketplace or transition people automatically. So it is still something where folks have to take action to continue coverage, and we'll talk more about what that looks like. So let's talk a little bit about the Marketplace, and hopefully everyone on this call is familiar with the Marketplace, but if you're not, this is a good time to learn about it. The Marketplace is a really quick and easy way for folks to have a one-stop shop to be able to compare plans, networks, insurance companies side by side. The plans that are available through the Marketplace are also available directly through insurance companies. They're largely the same plans that people can purchase direct. The biggest difference between going through the Marketplace and purchasing direct through an insurance company, though, is that the Marketplace is the only place where you can actually get financial assistance. And what we actually know is that during open enrollment for this calendar year, nearly 80% of Oregonians who went through the Marketplace qualified for financial assistance. And that includes premium tax credits, which help reduce the monthly out-of-pocket costs that folks pay to have insurance, and also cost-sharing reductions. And cost-sharing reductions actually reduce the out-of-pocket costs associated with coverage and care, such as co-pays, co-insurance, deductibles, and out-of-pocket maximums. So we will talk a little bit more about that, but we do want to encourage everyone to explore their options through the marketplace so that they know what sorts of financial help they can get, especially for the people coming off of OHP, because what we do find is that when folks are rolling off of OHP, typically they do qualify for a really, really nice financial assistance package. And then, of course, we do work with insurance agents, brokers, and assisters statewide who are able to provide one-on-one enrollment, application and enrollment assistance for folks to understand the process. So the good thing in that is that we do not expect people to be able to navigate on their own. We know this is, again, a new process for many people, and so we are partnering with experts to be able to provide that assistance. So this is just to give you an idea about the coverage that is available in each county of the state. So regardless of where you live, you're going to have at least 4 health insurance companies to choose from. And each health insurance company offers at very bare minimum 3 health insurance plans. So what we actually are finding, though, is that, you know, all insurance companies pretty much offer more than 3 plans. So everyone is going to have at minimum 26, 26 health plans to choose from. In some areas of the state, there are even up to 62 health plans to choose from. So the good news in that is that there's a lot of choice for people to help make sure that they're getting a plan that is fit to their health needs. The downside to that is that it does make choosing a plan a little bit more cumbersome because there's a lot of options to wade through. So we do have some tools to help, and we will talk more about that in a few minutes. Again, I do want to just mention, if anyone has any questions, please put them in the chat so that we can address those. Thank you, guys. All right, so this is just to give you an idea about the advanced premium tax credits that folks have been receiving that we've seen for 2023. So advanced premium tax credits are calculated based on what your estimated income is going to be for the year. And then the federal government says, well, based on your income and your household size, we think that you should be able to pay this percentage of your income towards your health insurance premiums. And that percentage can be anywhere from 0% up to 8.5%. So here in Oregon, these are some examples of the premium tax credit amounts that folks are receiving this year, depending on their income and their age. So you'll notice that there's a pretty good amount of assistance available, but even more, this will actually show you more of what folks are actually paying for health coverage on a month-by-month basis. So you'll notice that if folks have they're on the lower income side, they will pay less for their coverage than if they're on a higher income because they'll qualify for more financial help. It is important to know that plans are available for even less than $1 per month, but you will never see a completely $0 plan because there are some benefits that are included in marketplace plans here in Oregon, which are not considered essential health benefits, stuff like chiropractic and acupuncture. And so those do have a little bit of cost associated. So you will see a little bit of a dollar amount associated with those benefits. But regardless, what we do know is that the folks who are at the lower income ranges are going to be able to find a plan. And these are all silver plans. So the bronze level plans would even be perhaps even less per month. All right, so for the Marketplace Transition Project, we're going to see, this is what the project is kind of laid out and how the project is going to impact coverage and folks who are rolling off of OHP. So what will happen is people who are currently enrolled in OHP benefits will receive a notice from the Oregon Health Plan that says one of 3 things. Either you're no longer eligible, you are still eligible, or we need more information. So if they need more information, they're going to need to send in some documents or some information to be able to verify and validate their eligibility. But if someone does eventually or ultimately get you are no longer eligible for OHP notice, then that is where we step in. So what will happen is For every single person that is found to be not eligible for OHP, their information will be sent to the marketplace so that we can look at each individual on a one-on-one basis and evaluate their plan options. We will use our window shopping tool to determine how much in financial assistance each person will qualify for. And then if we have provider information, we will also evaluate the plans that are available with their providers to hopefully continue their continuity of care. Then we will conduct some targeted outreach. What that looks like is we will be sending letters to each individual person saying how much in financial assistance they might qualify for, giving them a couple of different plan options so they can kind of preview what's available. And we will highly emphasize getting help from local assistants, local experts. So just want to make sure that you guys know that those letters are going to be going out. And you know, if you are providing one-on-one assistance, you might see a little bit of an uptick in call volume. So just as a heads up, once about 30 days later, the federal marketplace is going to compare records with who was found not eligible and who has actually taken action. And they're going to send us a list of folks who have not taken action at about 30 days after they were determined not to be eligible for OHP. We will then take that list and we will say, okay, these folks need some more outreach so that they can take some action and hopefully avoid a gap in coverage. So we will be doing some additional outreach by email, text message, and direct phone calls to let folks know of their options and to offer assistance. Ultimately, the consumer will need to take action in order to maintain coverage through the marketplace. So they will have the option of either contacting our health center, visiting with an insurance agent, broker, or assister, or reaching out to healthcare.gov directly for enrollment. Okay, so we've got a couple of questions, so let me make sure I answer those. So Laura, you are correct. For folks, we always want to make sure that we rule out OHP as an option first. So if someone gets a letter that says you are no longer eligible, and they believe that there might have been a mistake in the determination or maybe incorrect information was used, then they can reapply for OHP. If they are found not eligible for OHP because they're over income limits, or maybe they're only eligible for CALM, then that would be where they would come over to the marketplace. Kayla, so will these letters come directly from OHA or the marketplace? So there's a couple of different letters that are going to go out. The first batch of letters are going to come from the marketplace, and we are an office of OHA, so they're coming from kind of OHA too. But we will be sending them directly from the Marketplace Transition Project Help Center. And then there will be another notice about 30 days later that will be sent from the federal marketplace. So there's two different ones. And Vixen, we are hoping that the first round of letters after someone is found to not be eligible for OHP, we do hope that those first round of letters, we're aiming to get them out within 7 to 10 business days after they're found to be not eligible. There's still a lot of unknowns about how many people we're going to get on each file, so we don't know for sure how long that processing will take, but that is our goal. Linda, that is a great question. So Linda's asking, do you know which groups are being sent notices and when they're being sent? So notices will start going out beginning of April. We don't have a ton of information about who will be receiving notices and when, but we will definitely communicate with our partners as much as we can. Okay, I'm going to hold off on these questions. My colleague Caroline, can you just kind of take note of where we left off? I want to continue on because I just want to make sure that if there's any information in the upcoming slides that we look at those first. Thanks, guys. Okay, so I know this slide is really busy, but it's kind of intentionally so bear with me, okay? So this is the experience that Oregonians will face when they're applying for and renewing health coverage during the Unwinding project. So on the left-hand side, you'll kind of see the OHP process. So if someone's determined potentially eligible for OHP through the marketplace, their information will be sent to OHA, ODHS to determine eligibility. And you guys are all probably very familiar with that process. And then if someone is determined, if you go up to the very top, if someone's determined to not be eligible or no longer eligible for OHP, then what will happen is they'll be sent a closure notice, and then you'll see that their information is sent to both us and their federal partners. We will send a notice out right away. And then at about 30 days, healthcare.gov will send a notice, and our transition project will begin to make some more direct outreach as well. So our goal is to get them into this blue box where the consumer is applying for marketplace health coverage so that they are either found to be eligible, not eligible, or potentially eligible for OHP. So in terms of communications to consumers, this is kind of what we're looking at here. And you can see examples of the notices. We do have them only in English on the website, but we do have 14 different notices depending on the consumer situation that will be sent, as well as 2 additional inserts. So the messaging that's going to go out to folks who are losing OHP benefits initially is going to be by postal mail. And the postal mail letter is going to say, really elaborate on when and how to enroll through the marketplace, how to find local help, and then again, touching on what sorts of financial assistance they may qualify for based on the information that was submitted to OHP, and then also what sorts of plan options are available. We also, again, at that 30-day mark, if they have not taken action, we will be doing some follow-up messaging through email and text messaging, in addition to some direct phone calls. So that messaging is being finalized. We will be doing some organic social media campaigns. We are largely piggybacking off of the overall OHA messaging campaign, because the bulk of this project is really making sure that people get through that OHP redetermination process. So we don't want to hinder that process at all, but we will be piggybacking off of that campaign to encourage folks who are no longer eligible to come over to the marketplace and check out their options. We do have printed publications that we have available. We have a new RAC card, which is getting translated into many different languages. We currently have in English and Spanish. We have some posters, and then we do have some FAQs for you all as well. And then we are here to be nimble and flexible. So any additional communication strategies that need to be implemented as the project continues on, we'll be flexible. We'll implement them. All right, so now we're going to talk about a new special enrollment period that is available to folks specifically that are found to be no longer eligible for OHP benefits. So this special enrollment period, which is called the Unwinding special enrollment period, is available from March 31st, 2023 through July 31st, 2024. This special enrollment period is available to anyone who is eligible for the marketplace and submitted a new application through the marketplace or updated an existing marketplace application between the dates mentioned. And they answer yes to the application question asking if they are losing Medicaid or CHIP coverage. And they also must attest to having a last date of Medicaid or CHIP coverage between March 31st, 2023 and July 31st, 2024. So there's not any documentation that's required to be submitted to prove that they qualify. It's all based on self-attestation. So that's important to know. But we do, of course, encourage folks to keep their OHP notices handy just in case. So the way that the special enrollment period is working on the application is it's all automatic. So basically, when you go through the application, you're going to see these screens pop up. So the first one's going to say, is anyone, in the household have OHP benefits that are recently ending or are ending soon? And it will give specific dates. And so you would say, yeah, these people have OHP that's ending soon or recently ended, and then you'd put in the date of the last date of coverage. There's also going to be a question to see if someone may qualify for OHP because, again, because they had some sort of income change or household change since they were found ineligible for OHP. So the marketplace is really doing everything they can to make sure that if folks should be routed back to OHP, that they are, but they also want to prevent people from getting into that loop. And so they're going to ask questions to kind of rule out OHP as well, so they can get people right fit to the program that is best for them. So the next second set of questions is going to be related to the loss of coverage special enrollment period. So this screen is what you would see in the typical place after the income section, where it's asking if anyone is losing coverage. And this is, again, to really determine if they might qualify for a loss of coverage special enrollment period. So it is a different special enrollment period than the unwinding one. The good thing is that this information will pre-populate, so it's really, really easy to kind of get through this little section. So a couple of key facts about enrolling in marketplace coverage. So coverage will start the first of the month following enrollment. So even if you enroll on the last day of the month, your coverage will start on the first of the next month. Now, we do want to note that folks can enroll up to 60 days before their OHP benefits close. The OHP closure notices will give a 60-day window, so the closure date will be at least 60 days in advance. So that kind of kickstarts their closure window and when they can start enrolling through the marketplace. Now, it's really important to know that once they submit their application through the marketplace, they have 60 days to actually enroll in a plan. If they do not enroll in a plan within 60 days, then they may lose out on that special enrollment period. So they can start their application anytime between March 31st of this year and July 31st of next year. But once they hit submit, they have 60 days to actually choose a plan. Marketplace coverage cannot be backdated or started retroactively. That's very, very important. We want to make sure that people take action before their OHP benefits close, if at all possible, so that we can hopefully prevent any gap in coverage, because marketplace coverage cannot go backwards. So if they have prescriptions or appointments that they need to go to, then we want to make sure that they avoid that gap in coverage. And then the last thing is that the first month's premium must be paid in order to start coverage. So once you enroll through the marketplace will send a bill for that first month's premium. And then they will need to pay that premium by the due date for their coverage to kick in. If they don't pay the bill by the due date, then their coverage will be canceled for non-payment. There's no grace period for that first month's payment. So Maria and Vixen, yes, the slides will be available after the webinar. And again, we'll go through the questions here once we're done. We're almost done with the presentation portion. So how can you help people that are losing OHP benefits through this process? So the first thing is we want to make sure that you know about financial assistance programs that are available through not-for-profit hospitals and affiliated healthcare systems and clinics. There are a whole bunch of participating facilities. So if you aren't familiar with this process, we encourage you to take a look. This is a sliding scale process, or sliding scale structure. So folks are able to get some help with their medical bills if they're not covered, or if they have health coverage. So if someone does enroll through the marketplace and the out-of-pocket costs are a little bit too much for them, for going to the hospital or doctor, they can ask for financial assistance, and that will kick in after their insurance pays. We want to make sure that folks know about their options through the marketplace. We recognize that we have a ton of assisters who don't have the capacity, especially as the unwinding process begins and OHP applications tick up. We know that a lot of folks aren't going to have the capacity to actually help people through the marketplace, and that's fine. We don't want you to stretch yourself too thin, but what we do encourage you to do if you help someone and they are determined to not be eligible for OHP anymore is we do encourage you to use our window shopping tool. It's really quick and easy. You just put in a few quick questions or answers to a few quick questions, and it will tell you what program they might qualify for, either OHP or the marketplace, how much in financial assistance they might get, and then it will show you a list of plans. You can even put in their doctors, prescriptions, or preferred hospitals, and it will really quick and easy tell you which plans cover those specific needs. And then last but not least, again, if you don't have the capacity to help with the marketplace application, or if you're not trained to do so, we do encourage you to offer a referral to a marketplace expert who can help with that process. We do have our locator tool available in both English and Spanish, and the links are on the screen. So really quick, the next few slides, we're just going to talk about the window shopping tool. I want to show you guys how that looks so you can see that it is very, very easy to use. Laura, to your question, the window shopping tool is available publicly, so anyone can use the tool. It is available for any Oregonian. And we do have the window shopping tool available natively in both English and Spanish, so you can use the links here on the screen. It is an Oregon-specific tool. It is managed by us here in the Oregon Marketplace. And it does also link to the Find Local Help tool, the Oregon Health Plan, and also healthcare.gov, depending on the consumer's needs. So this is what the window shopping tool looks like once you get to a plan screen. You can see that it will show the plan. You can see all of the details that would typically be in a summary of benefits and coverage document. You can also see the summary of benefits and coverage if you click that link there. There is a quick link to the drug and provider search. And then also, if someone wants to enroll in this plan, you can actually just print the plan details. And then they could take it with them when they go meet with an insurance agent, or if they go home to do the application on their own. So just want to kind of show you what that looks like there. The cool thing is that you don't have to put in a ton of personally identifiable information into the tool. Really, all you need to put in is how old the folks are that are in the household, who's looking for coverage. There's some other specific questions about if anyone's offered other coverage through an employer, if anyone's pregnant or a tribal member, and then what the estimated household income is. That's basically all you have to do. It's pretty easy. So for insurance agents and community partners, we want to make sure that you know that we are going to kind of lean on you guys a little bit heavy because we do encourage you to be the points of contact for your community. You are really critical in this whole process. You're critical to provide outreach and education to make sure that your clients know and the public at large knows what's going on. We want to make sure that you stay abreast of any information about the project so that you know kind of what to expect and what consumers can expect. We want to make sure that you know how to provide plan or choice counseling or plan advice. But again, plan advice is only if you're a referred insurance agent, of course. And then we want to make sure that you can provide application and enrollment assistance if that's something that's in your the capacity of your job to do. If you are not currently certified to provide marketplace application or enrollment assistance, we do have some information available on our website. We will drop the link in the chat. And that website does list how insurance agents can become certified, and then also how assisters can as well. And then we do have a new help center that will be open. And my apologies, there is a typo on this slide. It's actually not going to be open until the 13th of April. But the Transition Help Center will be available Monday through Friday, 8 a.m. to 5 p.m. to provide direct assistance, whether it's going through the window shopping tool, understanding their marketplace notices or marketplace plan options. They can help give referrals to local assistants or to the marketplace directly. And they can also provide enrollment assistance as needed. We also have an email box specifically for this project, so please feel free to reach out to us if you have any questions. And with that, that's my actual last slide. So I'm going to scroll back up. Caroline, where did we? Okay. Okay, thank you. So Vixen, you asked, how will consumers find assisters or agents? And will the letters show how to find assisters? So yes, that's a great question. We do have a whole section of the letter that does discuss different types of assistance that's available, whether it's through assisters or agents. We do talk a little bit about the fact that insurance agents can provide advice for plans. And then we do route them to the Find Local Help tool. Stephen asked, if more outreach is deemed necessary, what does that delay? Does that delay the date on which the insured member will be kicked off OHP? So no, so our outreach is not going to change anything with the OHP process. So when people receive a notice from OHP that they need more information to determine eligibility, they will have 90 days to respond. And then if they are determined to not be eligible for OHP any longer, they will have 60 days until their benefits close. So our outreach is really to try and grab people within that 60-day window before their benefits close to have them enroll. So we are staggering it a little bit to try and make sure that we don't, we don't have messaging fatigue for folks, because there's going to be a lot of notices flying around, but it will not delay the date their OHP benefits will end. Danielle is asking if assisters can help people apply on the marketplace. You can if you are trained to do so. If you have gone through the marketplace training, which is required as part of your certification to be an application assister, then yes, you can help people through the marketplace. You just cannot provide plan advice. You can provide choice counseling. And the difference is really, you can't say, based on what you've told me, this is the best plan for you. You can tell people, help them narrow down options. And then once they get down to 2 or 3 options, say, at this point, you'd want to make a decision, or, I can get you over to an agent. But you can absolutely help people through the marketplace, and we encourage you to. Betty asked, if they don't reapply for OHP, would they be eligible for an FFM special enrollment period? So if someone is removed from OHP because they did not respond, they will still qualify for that unwinding special enrollment period, because they are losing benefits between March 31st, 2023 and July 31st, 2024. So they can still say that they are losing benefits. Danielle is asking, as for people receiving phone calls, how will you be identifying yourselves so that people will know that they're legitimate calls and not scam calls? That's a great question. We haven't entirely worked out the scripting for the outbound calls. I anticipate that we will likely identify ourselves as the Marketplace Transition Help Center or the Oregon Health Insurance Marketplace. But we are trying to be as transparent as possible and letting you guys know what messaging looks like. So I will work with our program manager to determine if we can get those scripts out ahead of the calls happening, so that you guys know what they sound like. Robin's asking, what is the last date of coverage for those that are losing coverage? May 31st. So it's going to be a rolling date. And I'm sorry if I didn't make that super clear earlier. So April 1st is the first, or April of 2023 is the first month that redeterminations will be happening, but they will be happening over the course of the next 14 months through January of next year. So, so people will be losing OHP benefits up until mid next year as part of this process. And it really depends on how, like, when people respond, if they have to send in information and things like that. So it really does depend, but I will make sure that the link to the public health emergency website gets put in the chat. Caroline, do you mind pulling that website and putting it in the chat? There is a really great interactive tool on the website that does help kind of walk through and put into perspective. Okay, so in your example, you show that OHP coverage ends on the 24th of the month. If marketplace coverage can't start before the 1st of the month, what happens if they have a gap in the services? So Robin, my understanding, and I'm not an OHP expert, but my understanding from the OHP experts is that coverage will always end for OHP at the end of the month. So that should not be an issue. But if you find that that is an issue, please let us know. Vixen is asking if the enrollment start date is known to insurance companies. Yes, it is known to insurance companies. They may bill, if someone enrolls at the end of the month, the bill may come after the 1st of the month, but the coverage would still be effective the 1st of the month as long as they do their enrollment or pay that premium, sorry. Linda is asking if they don't make the premium payment on time or if they don't complete the application 60 days after starting, can they start another application? That is a great question. We're going to take that back to our parking lot, and I will add that to our FAQs because I'm not 100% sure of the answer on that, Linda. So can you mark Linda Dugan's question 1027? And then Linda Aldridge, will you be working return mail if a letter is undeliverable? Otherwise, they may not know about coverage termination. So that's a great question for our notices. I do believe that we are trying to forward. We're asking the post office to forward as much as possible to new addresses. However, we do know that return mail is inevitable, and we will be working those. We're still kind of finalizing what that process looks like. But yes, we will be trying to do that. And Laura asked about the window shopping tool earlier, which I already answered, but yes, Oregonians can use the window shopping tool themselves. And then also, is the help center public for Oregonians? And yes, that is going to be available for all Oregonians and listed in the notices. Will notices be sent based on an enrollee's renewal date? I'm assuming that you're asking about OHP notices. My understanding is that they are not based on traditional enrollment dates, but I am not an OHP expert. So I can't entirely answer that, but you might check the FAQs on the public health emergency site, which Caroline, I think, dropped in the chat, and it should be on there. Lucy is asking, how can people ask for this info if they don't get the letter? We work with folks experiencing houselessness who don't have consistent methods of communication. Can people call the One Customer Service Center to check on the status of their OHP coverage? So I can speak to this from the marketplace side of things. If we have folks who do not receive their letter, then they can contact our transition help center, and we are more than happy to help them. They will have copies of their letters that were sent out. They'll be able to see if it was returned, things like that, to help them walk through the process. For the OHP side of things, I do believe they can call the One Customer Service Center, but again, that would be more of an OHP question, so I'm not 100% on the answer for that. But I would also encourage them to reach out to a community partner, especially if they've worked with a community partner in the past, because that community partner should be able to pull up their information. Laura asked a fantastic question. Does it cost money to talk to insurance agents to sign up for insurance? And how would Oregonians know which agents to contact and how to contact? So all of the help available through our website is entirely free. The insurance agents that we work with do not charge anything for their services. They do make some money on the back end through commission, but they're all licensed and bonded to provide this assistance. So, and they do not charge money to the client for their assistance. So we do really encourage folks to reach out because they are experts in the areas that they work, to know provider networks and things like that. And to find assistance, you can go to oregonhealthcare.gov/get-help. That would be our English search tool, and there's an option to search for marketplace assistance. Vixen, when will the rack cards be available? We will likely have them available online for ordering later this week. We're just making some finishing touches on our translation for the Spanish. If someone loses coverage, oh, Maria, I'm not sure if it got, sorry if your question got cut off there. I'm not sure what you're asking. Okay, Nancy, is there an example of the types of notifications members will receive and what they'll state? We do have copies of English notices on our website right now. I'm going to drop the link in the chat. The English notices are available. If you click I'm an agent, broker, or assister, you'll see them at the very bottom of the page. And we do have them translated into, they'll be going out in a variety of different languages, but we do have the English ones on there. Oh, Maria, I'm sorry. I see the rest of your question. Okay, so if someone loses coverage on 5/31/2023 and they do not use the 60-day window, can they apply before 7/31/2024? So yes, they can apply anytime between 7/31/2024. Once they submit, submit their application through the marketplace, they have 60 days to actually enroll in a plan. But yes, they can do it anytime between basically when they get that closure notice in July 31st, 2024, and their coverage would just start the first of the following month. So Donna is asking if a confirmed OHP termination date is required. Yes, you would need to know the date that the OHP benefits are ending. So is asking on a late payment, it depends on the insurance company. Normally they have grace periods 28 to 30 days based on the date they sent the letter of billing. Once the grace period is passed, they will no longer take payment. So that is true if it's not for the first payment, which is the binder payment. They do have to submit their binder payment on time. Otherwise, they very likely will be canceled because that first payment does lock them into the plan. Tina, no worries on coming in late. What will cause someone to no longer be eligible for OHP? That's a good question. So there's a few different things that may cause someone to no longer qualify for OHP. One may be that their income has increased over the pandemic. As we discussed before, people have been on the continuous coverage through OHP largely since the COVID-19 pandemic began. And so if someone has experienced any sort of change since the pandemic began, if their household size has changed, income, anything like that, then they may no longer qualify for OHP. So it's kind of the typical reason someone may not qualify. The other thing that I want to point out is that there might be some folks who are getting CALM Plus benefits who no longer qualify and do not qualify for Healthier Oregon. So they may be reduced down to CALM only benefits, which is emergency only Medicaid. If that's the case, then they can potentially go through the marketplace and get full coverage to kind of support their emergency only benefits. Laura is asking, any recommendations on how to assist individuals who speak languages that notices aren't available in? Yes, I can drop a list of the languages to your second question. I will drop a list of all of the languages in the chat. Sorry, it's copying really weird. So we do have a pretty good list of languages. We went based off of the most common languages. I think the top 14, including English, if I'm remembering my numbers correctly. So hopefully we will be able to provide information in the language of choice for everyone initially, and it will be based on the languages that are preferred, the written language preferred on the OHP application. If someone needs information in a language that is not on this list, please have them contact us so that we can see about getting the notice translated for them. We also have assisters and agents who are able to provide assistance in a multitude of languages. And if you go to our tool, there is a way to search for those different languages. Margaret, if they're choosing a marketplace plan because they know they don't qualify, what date should we use since we're not sending in a redetermination form? So if someone is currently enrolled in OHP benefits, it is highly, highly, highly encouraged for them to do the redetermination process first. To determine if they're still eligible for OHP benefits, even if they think they may not qualify, for two reasons. One, because we want to make sure that folks are getting the benefits that they are entitled to. So if they're still eligible for OHP, we want to make sure that they're staying on that program. But also because the marketplace will need to know what date their benefits are ending. And they do some cross-checking in the background to make sure that folks aren't dually enrolled in OHP and marketplace. So if someone is still enrolled in the market or in OHP and they go to the marketplace, there's a chance that the marketplace is going to say, oh, it looks like they're eligible for OHP. And then they kind of get stuck in a loop. So the best thing to do is to wait until they receive their renewal notice, have them go through the process. And then if they're determined no longer eligible and they get a closure notice, then they'll know what that date is to report to the marketplace. So is asking, no document required, proof OHP ending during the unwinding special enrollment period. That is correct. It is all self-attestation. They do not have to provide documents to prove. And Danielle is asking, where's the link to get the flyers, posters, and other documents for us to print for our offices to inform our clients of information? So I'm going to put the transition website in the chat. And we have a bunch of information on our website in addition, or we also have our FAQs and for both clients and for you all. And then we also have the samples of the notices. So you're able to see all of those. And if there's anything that you need that's not listed, please let us know. We're happy to help. I think I went through all the questions in the chat. Does anybody else? Oh, yeah. Caroline says we have more questions. Let's see.
Yeah. So if someone is eligible for the Magi Expanded Adult Program, 138% to 200%, and decides they want to be on a marketplace plan, will they still be eligible for tax credit?
So this question, my apologies, you may not have heard Caroline here in the background. The question is, if someone is eligible for the Magi Expanded Adult Program, which is 138 to 200%, and they decide they want to be on a marketplace plan, will they be eligible for premium tax credits, or I'll just kind of round it out and say financial assistance through the marketplace. So Sean, that's a great question. And so keep in mind that the Magi Expanded Adult Program is still pending because we need to get CMS approval. If CMS does approve that program, then no, they would not be eligible for financial assistance through the marketplace because they would be eligible for the Oregon Health Plan, which is considered minimum essential coverage and is, obviously affordable because there's not any cost really involved. And then in regards to Healthier Oregon expanding, if it is expanding, I have not heard that has been final. But if it does expand, then yes, we do recognize that there will be some folks that may be moving to Healthier Oregon at that point, and we will make sure to communicate that out when we know for sure. Anadelia is asking if the 5-year bar is still in effect. So that is a really great question. The Healthier Oregon program did kind of eliminate that for some age ranges. So if if folks are within the 5-year bar, they may be able to get full OHP benefits under Healthier Oregon. But if they're not in the age ranges that are currently on Healthier Oregon, then yes, they can still go through the marketplace and get financial help if they're within that 5-year bar. Okay, I think I got everything. All right. All right, I think we're good. So what we will do now is we will go ahead and post this recording to our site. So if you have any questions, feel free to watch again. And otherwise, I will stay on here. So if you guys have any additional questions, please feel free to ask. Yes, kids under 19 are still able to get OHP as long as they meet income criteria. So there is still an income. Betty, we're not covering bridge program right now. There's still a lot of things that they're working out on that, but we will get the information out as soon as we can.
And what is the recording you posted?
I'm going to post the link again to our marketplace transition site, which is where we'll post it. Thank you, everyone. Hi, Teresa. So if someone is found eligible for the expanded expanded adult Medicaid program, then they would be considered to qualify for assuming that it gets approved by CMS and all of that, then they would be considered eligible for minimum essential coverage that's considered affordable. And so they would not qualify for financial assistance through the marketplace, but they could purchase a plan at full cost. If anyone has questions about Medicaid, I would encourage you to reach out to the regional outreach coordinator for your region. If you don't know who that is, please feel free to email or message your marketplace contact, and we will get that to you.
And someone is asking where the letters and other notices and posters can be found on the.
Oh yeah, the marketplace transition site is where you can find all the letters and notices.
They can't seem to find where it is going to that page.
Oh, if you click on the link that in the chat for the marketplace transition site, and you go to where it says I'm an agent, broker, or assister, it'll be at the very bottom of that page is where you'll see all the notices. We don't have the posters or the rack cards up yet, but the letters are up in English. So Donna, currently, if you're over the 138% of the federal poverty level, unless you're pregnant or a child, you likely don't qualify for OHP. The Oregon Health Authority has petitioned to the Centers for Medicare and Medicaid Services, CMS, to temporarily expand Medicaid in Oregon up to 200% of the federal poverty level for adults who qualify otherwise based on immigration status and so on. If it does go through, then people who are up to 200% of the federal poverty level would automatically be moved to that program as they go through the renewals process if they are within that income range. Roger, can marketplace agents sign up to get OHA referrals from those losing OHP coverage? So that's a great question. The best thing that I would recommend is if you are listed on our website, then you are likely going to get calls from folks who need help with marketplace. If you are not on our website, we do encourage you to fill out, there's a short survey that you can fill out. I'll put that in the chat, and you can put your information to make sure that that we get you added. All right, everyone. Thank you so much for attending. This was really, really fun and a really successful webinar. We really appreciate it. We will get this recording up on the website as soon as we can. Thank you so much and have a great rest of your day.